Hello everybody, how you doing? Today I'm going to be talking about my Achilles journey, weeks 5 and 6, and how everything's been, and how I've been dealing with the ups and downs, my exercises and my recovery, how I've been finding the new boot position. So in the last video, I spoke to you about weeks 3 and 4 and my actual appointment with my physio. At the end of week 4 was like my first consultation with my physio. In that consultation, he checked my scar, took the bandage off just to see how it was looking, replaced it, and said that everything was looking really good. He adjusted my position of the boot, this Vacoped boot here. Uh, he adjusted that to 3 to 1.5, which allowed a little bit of dorsiflexion in the ankle to help promote the work over the next few weeks to get towards neutral 90 degrees of dorsiflexion. He also checked the integrity of my tendon just by having a little look at it and the Thompson squeeze test. If any of you don't know what that is, and I've not explained it yet, it's basically where you relax both of your legs and you squeeze the calves of the leg, and that will actually allow movement of your foot. So he checked the Thompson test with me just to see how the movement of my foot was there, and there was movement there, which is a really, really, really good thing. It means that the tendon's healing. Obviously, there hasn't been a scan on the tendon yet, and there hasn't been another consultation yet in terms of going to the hospital and seeing a doctor to check whether the tendon's actually stitching together. Basically, at this stage, you just have to rely on what the physio's telling you, and be reassured that if he's saying that you're healing, you're healing. So he did the Thompson test. There's movement in my foot, no problems whatsoever. He also checked the range of movement as well. So he, moved my ankle a little bit, pushed my foot to dorsiflexion a bit, to plantar flexion, asked me to clench my toes if I could, and my foot move to the side, left and right, things like that, just to make sure that there isn't any further complications with the ankle area. Within that consultation, he obviously replaced the bandage with a new one as well to help keep it protected. I felt as though it was healing really well, and that I didn't necessarily need it, but he just said just keep it on for a little bit longer, and if I feel like taking it off, just take it off, if it's actually just getting in the way of me going to get a shower and things like that. I left the physio centre, and it was a really good consultation with him, to be honest. Asked him plenty of questions just to make sure everything was okay, and getting plenty of reassurance, and I felt really good. So that day I went back home to do the exercises. Now, in the last video, I mentioned that when he put me in that first position of number 3, not to put my foot down straight away. But this time I asked him, is it okay if I just put weight on there as I'm walking with the crutches in that new position? And he said, yeah, it's absolutely fine to do that. Just obviously be careful over the next couple of hours or so, but the tendon will naturally just stretch slightly. So I was in that new fixed position of 1.5, which felt a little bit weird at first, but the physio knew exactly what he was talking about. We seemed to be where we needed to be in terms of the timelines, so he was confident for me to go away and put some weight on that whilst walking with the crutches. So the exercises themselves consisted of sitting on the floor and putting your foot as flat as possible against a door or potentially a wall, and making small pushes with your foot into the wall or door so that you can get some minor contractions of the calf. That was one of the exercises. The second exercise was to do foot pumps. So whenever I had my boot off, lay down in bed, or if I'm sat on the floor with straight legs, all I would need to do was kind of just bring one foot forward and the other one back and just rotate this. just to kind of get the brain used to moving that foot, the injured foot, obviously, just to see whether you can get some good flexibility through it. Now, I'll say in a minute, in the first instance, I didn't have really any movement, to be completely honest. And I knew that this was going to take a little bit of work because it was kind of uncomfortable to start with. The other exercise that he got me to do was actually not really an exercise, but just to massage the scar area and the wound area. Now that it was completely healed, he did say try to gently use your thumb and finger to massage the tendon area, just to help with blood circulation and to promote effective healing in that area as well. I did find that when I started to do the foot pumps, I would do it in bed, and I would usually do it when my foot was raised on the leg pillow as well, and it was very uncomfortable to begin with. I wasn't getting much plantar flexion at all, and I really, 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 really wanted to clench my foot, and I haven't done that for a long time, obviously. But the feeling of being able to like clench your toes down and your foot in that plantar flexion is something I really wanted to do, but I couldn't do it. So I did try, but straight away I got some discomfort within the tendon area itself. I could definitely see how the plantar flexion of the foot and the contraction of the foot muscles connected to the back of the tendon itself and runs up to the soleus and into the gastrocnemius, the calf muscle. So you could definitely feel that. So if you're at this stage yourself, try to like squeeze your feet, as in, you know, the movement if you were to put your foot on a towel and you were trying to like grip the towel with your toes. If you try to do that movement, you will actually find discomfort in the back of the tendon. It's almost like the tendon's a bit sticky within its area, and these exercises are kind of dislodging the tendon to be able to slide up and down the leg a little bit more effectively, obviously reducing any scar tissue around the tendon itself and also building up strength in the tendon at the same time. So I can really see how these exercises over time gradually increase the range of movement and also allow the strengthening of the tendon. Vitally important to do them every single day. I did find that with those foot pumps, by the end of week 5, which was like a week obviously after my consultation, I did I was able to actually have a little bit of clenching of the foot, and it felt great, especially like the big toe itself. Like the the toes, excluding the big toe, kind of were clenching, and my foot was clenching as well. But the big toe itself was kind of resistant because that's the main tendon that runs through the foot that goes into the back of the tendon. So I think if you can get to the point where you're actually being able to clench your foot considerably by the end of week 5 or even at week 6, I think you're in a good place, to be honest, because then that means that your foot is working in conjunction with your tendon and your muscles at the back of your leg, and everything's moving along swiftly. So I actually felt that this was happening, and I felt really pleased by it. The exercises were obviously paying off. Now, just to summarize what the exercises were in terms of reps and sets, I was told that for foot pumps, you're looking at doing it 30 times on one side of the foot. That's plantar flexion, dorsiflexion, 30 times without trying to pull the toes too far towards you on dorsiflexion, just to kind of get the calf muscle and the tendon moving a bit. So that would be 30 reps with about 3 sets, or however many you felt comfortable doing. Like I said, I did feel a bit of dull aching, and I did feel a little bit of pain in the first few days that I was doing this, so I kept it at that strict 3 sets at 30. But towards the end of week 5, I increased this a little bit. Just willy-nilly, whenever I was laying in bed, I would just practice those whenever I felt like, because the more you do it, the more you're going to increase that range of movement, and you're also going to increase the strength in the tendon area as well. Now, the second exercise, which is one that I highly recommend doing as much as you can too. Even though they say do it 3 times a day on each exercise, you're looking at about 15 reps to 20 reps 3 times, pushing against the door or pushing against the wall. Now, obviously, you can see in the video here that there's hardly any contraction whatsoever in the calf muscle. There's hardly any contraction either side of the gastrocnemius, but you can see a little bit of movement within the soleus area, and it doesn't feel like much is happening, to be honest, when you're doing this. So you have to be persistent with it. It's a bit boring, but just whenever you can do it, just do it. Do 3 sets of 15 to 20. If possible, and it feels comfortable to do so, do 30 reps 3 times. As I got to the end of week 5, I found myself doing about 30 reps. And I would also do an isometric hold at the end as well, for about 20-second hold, just holding that contraction in place, because I've heard that if you can do isometric holds within the tendon and calf area, that actually can promote tendon healing a lot faster as well. So I've tried to incorporate those holds into the movements as much as possible too. And then obviously you've got the massaging of the tendon itself. So at the end of the day or before the exercises, I would try to increase range of movement in the tendon area by massaging it and warming it up, because there was nothing worse really than trying to do these movements when you were tense and when you were cold as well. So make sure you warm that area up first with your fingers slightly, and then go into your exercise, because that should help increase the range of movement and hopefully prevent you getting injured as well. I will say actually there was another exercise that I completely forgot to mention, which was so boring that I forgot all about it. So this exercise is being sat on the end of your sofa or a bed, or sat in a chair with your foot on the floor, obviously out of the boot. And what you are trying to do, the same cases that you want to contract your foot as if you've got a towel underneath you and you were trying to grab the towel. A similar type of movement, but you would do it internally. So where the big toe was and the inside of your foot, you would try to lift that off the floor a bit and tense it. And then you would also roll the other way as well with your little pinky, your little toe. You would also try to lift that off slightly as well. And I found that when I did this movement after the first 5 days of doing it, and I started to get strength in that area, I could understand why that movement was being used, because it's all good and well doing the plantar flexion and the dorsiflexion, getting strength in the calf muscle, but you've got loads of little ligaments and tendons and muscles in the ankle area. So when you're doing these sidewards strength exercises, you're actually strengthening the ankle area to support the tendon as you go forward over the weeks, so that you've got a nice strong foundation. Very, very vital thing to do. And this was the thing that actually helped me considerably to have a little bit of range of movement going left and right with my foot, and also being able to squeeze my foot in plantar flexion and clench it. I would recommend doing those exercises the same amount of times. Try to do 15 on each side, 3 sets of that, or maybe if you can do 30 on each side, then fair enough. Excellent exercises, very, very, very boring and repetitive, but worth doing them, because I swear if you start them at the beginning of week 5, by the end of week 5 you'll already be seeing big improvements. So at the end of week 5, I checked my wound again. I just had a little peek just to see how it's doing, and there was no blood, there was no scabbing or anything in the area, and I just actually had a way with it. I couldn't be bothered wearing that anymore. It was doing my head in, to be honest, and I wanted to actually access my tendon area better when massaging as well, because I wanted to use either like a moisturizing cream or some kind of oil to be able to massage that area more effectively. So I got away with that, and this made things so much easier when cleaning that area after having my boot on. And I did find that taking my boot off at the end of the day and cleaning the lower end of my foot, my tendon, with some baby wipes, for example, was a breeze. And I will admit, by the end of week 5, I was actually walking a little bit, as you can see in the video here, around the house. Now, I had to be very careful when I did this. I had to ensure that I would never bring my leg beyond a certain point when walking forward. It would always stay out in front of me, but I was able to put full weight on the leg itself. And I think I got to this point because I have been putting weight on it previously over the weeks and allowing myself to test try all that. I definitely do believe that putting weight into the foot early on allows room for you to get stronger in that area to be able to do this. Now, I wouldn't recommend this. I only did it maybe for half an hour a day just to get about the living room, or to get into the kitchen, just so I wouldn't have to have the boot on, because obviously, if you've got the boot on, your right, whichever side you're injured on, will be raised higher than the other one. So your back and your side starts to hurt over time because you're constantly like shifted and your pelvis is in a crazy position when you're walking. So it was really nice actually to have like my foot planted on the floor and evenly distributing that weight. More so, I would say, on my left side, but I could, if I wanted to, kind of stand there for about 20 seconds with weight on both sides. Now, the beautiful thing about this is this allowed me to get a shower very well. So no need for the boot, no need for a boot cover or anything like that if you're using one. This just enabled me to carefully hold on to something whilst getting in and out of the bathtub, so that I could then stand up and have a shower. Now, I'm instantly going to tell you all not to do this, okay? Because as soon as you start putting shampoo or shower gel on you and that goes under your foot, it becomes very, very slippy, and it can be so easy to slip or be jerked in a certain movement and then injure yourself. Now, obviously, I was very conscious when I was in the shower of this, so I would not move my foot position at all. I would literally stay as static as possible whilst I washed myself, and I would rely most of my weight to be on my left foot and not to move, because I could not afford to slip. So the beauty was that I was able to clean the wound, and the back of my leg and the under my foot so much easier. But if I was to recommend to you, I would still use the whole method of taking the shower head off, sitting down in the bath itself, if you're at this point without the boot or without a bandage, and actually clean yourself that way, because you're not going to slip over. The only problem with that is you have to then get up in a wet bath to get out of it, so you could actually increase the slippage on that too. So this is why I don't recommend it, but it worked for me. It might work for you, but don't take it as any advice, please. If you're going to do it, be extremely careful, because you do not want to be injuring that tendon area. I did find that when I was wearing the boot, it was amazing because it was actually allowing me to stand in the kitchen fully weight bearing on that right side without any crutches. I was walking around the house with no crutches whatsoever. I could go up and down the stairs, as you can see here, really, really easily, up and down, no problems, as long as I obviously was being very careful where I stepped. You do not want to be slipping on the steps. But things like washing your dishes or making a brew or cooking became a doddle. And I'm so thankful that I'm at that stage where I can just stand and do the things that I need to do in general I could actually hoover up as well. I got to a point where I was even hoovering up, so I was very happy about that. Hello, you're here to interrupt me. So in the beginning of week 6, I was starting to feel a lot more confident in my ability to do the exercises and also getting around the house, and life just started to feel a lot more positive. I think week 6 is like one of the best weeks in terms of your journey, where you actually start to feel like you're just progressing. And it gives you a lot of hope, and it actually gives you a lot more motivation as well to be able to get out of bed in the morning and to hit the day running, not literally, and enjoying life a little bit more. So when you get to this stage, you start to feel a little bit more positive about life. You start to feel like the end goal is in sight, and that going back to work is not actually that far away. So yeah, it's a really, really nice week 6. I did find actually that in week 6, when I was resting my leg, I would sometimes try and have a nap without the boot, and this worked okay until it didn't. So I remember when you're going to sleep and you sometimes jolt yourself a little bit. Well, I jolted my leg, um, and it was quite a weird twitch actually that happened in my foot, which I couldn't actually mimic myself. It just is something that the leg does, I think, when you're asleep. And I felt a little tug in the back of my tendon. But obviously, it's not going to injure your tendon because you're at a stage now in week 6 where there's sufficient healing that's happened in the tendon area. It just feels a little bit weird. And if any of you are a bit if any of you are afraid that you might injure yourself like this, I would say that you probably won't. I actually did say to myself that I was going to like try and go to sleep in week 6 without the boot, but because I had that nap and that happened, I completely disregarded that idea. So although it can happen, I would highly recommend not going to sleep without the boot yet, because I just don't think that your dorsiflexion is at the point it needs to be in case accidentally push on your other leg when you're asleep, or whether you have a bit of a weird movement or jolt in the sleep as well. You're not at that flexibility yet, and you don't want to be damaging your leg while you're asleep. So I highly recommend keeping the boot on still. I know it's a nuisance, it's a pain in the arse, it's really hot, especially in the hot weather, but you just got to grin and bear it. So at the end of week 6, I had my second consultation with my physio in preparation for week 7 and 8. He had seen me and told me about the new exercises that I was going to do. He also told me about the new positioning that he was going to put me in, and also just how I'm doing in general as well. And he would do the Thompson test again, but he would also do a little bit more testing with the tendon itself. He would kind of push in that area a little bit more with the thumb. He would see what the alignment and the straightness of the tendon was like. He would push a little bit harder against the sole of your foot as well, because he needs to make sure that the strength is coming along nicely in your tendon, and he wants to see what your limitations are. He also did the range of movement as well. I am very pleased to tell you that I'm healing quite fast, to be honest. And I'm doing everything that I need to be doing, and it's working. But in this session, which was for week 7 and 8, he put me in a new position in the boot. Now, the boot itself was already in a 1.5 position, static position, okay? So when you roll through your foot, it stays static to the foot. It doesn't allow any movement of the ankle area whatsoever. Now, weirdly enough, I thought that I was actually going to get myself in position 0 in neutral, and the large wedge was going to come off and the small wedge was going to go on to enable me to walk at this stage. Well, I've got a piece of paper here saying that week 6 that should be the case, but he said no. And I thought, oh, am I behind the timeline then? And he said, no, it's a general consensus that that's what the hospital will tell you to do, but as a physiotherapist, it's much better to do it the way that he was going to do it. And the way that he did it was he'd take the position from 1.5 to 0. He'd drop it and he'd put it in that neutral position with the large wedge. But he'd also keep the other position in position 3. And I said, what's that for? And he said, well, what happens is when you're rolling through with your foot, the boot itself will allow movement to a certain degree. So you were in a more neutral position. He made sure first that before you go in that neutral position that you could actually stand up straight, which I did at the end of week 6. He will tell you to stand up without your boot and just try to stand up at 90-degree angle, which I could. That shown him that he could then move that position in my boot to 0, which is the neutral position. So like I said, you go from the 0 position to number 3 position, and it actually at the back of your boot, as you can see in the video here, you'll see that it can slide up and down, and that enables the boot to go from the 3rd position to 0 position with some flexibility. Now I said to him, oh my god, that's so weird, like isn't that going to like strain the tendon and stretch it when I'm walking, when I put weight on it? And he said, yeah, that's the whole idea. And I was like, wow, I thought it was always going to be static. And he said, no, this is how it's going to work, and this works very well. At week 6, you should be able to do this. So when you're walking with your crutches, you should be able to have that small flexibility of dorsiflexion in your tendon and that slight stretch at the back. This obviously enabling the stretching of the tendon, but also the movement of it up and down the leg, and also the increase and progression of strength over the next 2 weeks. Because he told me in week 8 that I should definitely be in the smallest wedge, and I should be in like a minus 1.5 position. And I got a feeling that that's going to be the same, probably a minus 1.5 with more dorsiflexion to maybe position 3 as well, which allows me greater range of movement when walking. So I'm interested to see what week 8 is all about and how that's going to feel. But for the time being, position 0 to 3 with that small range of movement when walking. Okay, so I left the office. Another great consultation with him. He told me I'm doing excellent at the moment. Keep doing what I'm doing. Keep doing the exercises, and give those new ones a go too. So I'm really feeling quite positive going into the next 2 weeks, which are week 7 and 8, which will be obviously coming up to 2 months after the operation. I'm really excited about these new exercises because they're going to increase the strength in the calf area a lot more, and hopefully increase the strength in the tendon too. The new exercises that he's given me are to stand on my injured leg without the other leg, okay, with just holding on to a bit of support in the boot for 30 seconds and doing that like 3 sets 3 times a day. He also wants me to do some heel raises, which is crazy. I know at this stage, it's like, what? Heel raises already? Yes, but in the boot. I don't really know how this works, but apparently if you can try and match the level, maybe get yourself a couple of books to stand on with your other foot to make sure you're kind of level, you can actually try and do some heel raises whilst in the boot. So I'll be giving that a go. That's going to feel weird, I can suspect. So yeah, that's the most daunting one, I think. But he's assured me that it's absolutely fine because I have the security of the boot. So that will be the same, trying to do maybe 15 to 20 reps 3 times a day. Okay. Third exercise, you're looking at banded exercises. So yes, week 7, you're going to be using a flexible band that you'll put around your foot. You'll straighten your leg out, and you'll be doing the plantar flexion. And you'll probably do about 30 repetitions. 3 times. I had a little look online at some studies. It's actually shown that you can maybe do up to 100 reps 3 times, and that can be good for you in terms of like increasing your strength and healing. So I think when the physio talks to you and he tells you, do 15 to 20 reps 3 times, that's like the minimum, I think. You obviously do it within the limits. If you feel any pain or anything, obviously you stay away from it. But if you can do more reps, do them. I did more reps in weeks 4 and 5, and it's brought me about into a really good position. So I'm going to continue doing that in weeks 7 and 8. Okay. Don't take my word for it. It's only what I've researched online. But maybe just ask this to your physio and say, can I do more reps than you're giving me? He probably is going to say yes, to a certain degree. Just to reiterate, the exercises that were given to me up until now have been working. I've been doing them as much as I possibly can and feel comfortable to do. And I really feel like that's why I can put the weight into my right foot with and without the boot to a certain extent. And I think it's only going to get better as time goes by. And obviously, I'm feeling good about the whole journey so far. I feel like I'm doing everything I should do and it's paying off. My mental state is much better than I thought it would be. Like I discussed in my first video with you guys, when I injured it the first time in October, when I did the non-surgical route, my mental space was not in a good place. The first 8 weeks were terrible, but this first 6 weeks has been actually quite good. So stay positive, stay focused and motivated. Continue to watch loads of videos on YouTube about people's journeys, because that's really helped me understand my limitations and what's coming up next. And also drop yourself some comments in my video if you've got any questions that you want answered, because I'd be more than happy to help you. There's probably things that I could talk about forever with you in terms of this, because I've been educating myself on it constantly by watching videos, watching doctors, watching physiotherapists, watching surgeons about the whole shebang, and it is a very interesting subject. So if you're ever unsure about anything, just ask away and find like-minded people who have gone through the same experience to get the help you need or the support that you need. Don't dwindle away by yourself at home, kind of playing victim to it and feeling sorry for yourself, because I don't think that's good for anyone. I don't think that's good for healing either. You need to have a strong mind. You need to be positive and motivated most of the time to get yourself through this, and to do the exercises and to get strong again. So obviously I have the next 2 weeks to do. I will be coming up to the 2-month period at the end of that. And in my next video, I will actually be showing you how those 2 weeks transpired. So I really hope that you can keep up to date. Hopefully soon I can put weeks 7 and 8 up for you all to see how I'm progressing. And I'd love to hear how you're all doing yourselves. Where are you up to in your Achilles journey? Or have you had your surgery in the past? Have you just had it now? Or are you expecting to have your Achilles surgery in the future? Please let me know. I'd love to know where you're all up to. And it's been a delight speaking to you about weeks 5 and 6. It's been great. So I will see you soon in the next video. Stay positive, chin up, and you'll get there. Things are looking good now. So I'll speak to you soon. Thank you for watching. Take care.